Medical expert Dr. Mark Anderson, obesity now classified as a disease. When did this happen?
Last Tuesday, the American Medical Association passed it to recognize obesity as a disease state.
All right, so if I understand, if you classify this, this means it's different as far as how we approach this, but also it would indicate to me, and maybe I've got the interpretation wrong, that you can't do anything about obesity.
It doesn't change what we do here on the front line. When we see patients in our office, we address their weight as an issue. I mean, we take them in, we do their height and weight and vital signs each time.
Yeah.
As a community or public health, it changes the way we view obesity for sure.
But when you say it's a disease, to me that indicates that I can't stop this or control it. It's a lot different to me than cancer, diabetes. Those are truly they come on to a person. And while you might have had a bad lifestyle, it doesn't guarantee because you smoked you got cancer. You can't guarantee that kind of a correlation. But you certainly can stop eating. You can certainly cut back on what you're eating. I would think obesity to me is something that we have a little more control on most cases.
That's true. And I think the hope here was that by recognizing it as a disease, that it garners the attention to get patients to start making those changes and start working and paying attention to what the weight is and try to avoid some of the complications of obesity down the road.
Yeah, but do people feel sorry for heavy people? Do they feel sorry for obese people saying, it's a disease, honey, they can't help it?
Well, it runs that risk that all of a sudden people fall into that trap of saying, oh, that's not my fault.
Yeah.
I've got this disease and I can't do anything about it. But we have patients that have other diseases that make lifestyle changes to correct them, so hopefully they will with this too.
Interesting interpretation, interesting designation. What led to this? Was there a campaign for this?
No, I'm not sure. I didn't recall seeing or hearing anything about a political agenda, but obviously there was something behind it.
Yeah, okay. Well, again, unusual. Obesity now a disease. Obesity meaning X number of percent of your body over that, right? There's an ideal body weight. If you go this far, you're obese, correct?
Well, it's based on body mass index. And if your body mass index is over 30, by definition, that's obesity.
Gotcha. All right, Mark, we'll see where it goes from here. Appreciate your time as always.
Thank you, sir.
Thank you, 811. I don't know about that either. That you're just, again, you say they've got cancer, they got diabetes, they got, I think haven't we deemed alcoholism as a disease?
Right.
Because of the pull and the lure and the power that is alcohol?
Mm-hmm.
You can be a drug addict. Is that a disease? There's some choices you make. And again, when you come talking obesity, I think in our society we still look at that as something that is relatively our fault. We don't look at somebody with cancer and say, look at them. They've got cancer. They can prevent that. We don't know. We can't do that.
That's right.
But when you look at a heavy person, you can call it fat discrimination, whatever you want to do, but it's there.
Mm-hmm.